As we move further into winter in the Northern Hemisphere, we are seeing a rise in acute respiratory infections, a trend that is common during this time of year.
Respiratory illnesses like seasonal influenza, RSV, and hMPV are circulating more widely, alongside other pathogens like mycoplasma pneumonia. These viruses are typically more active during colder months, contributing to higher rates of illness, particularly in countries with temperate climates. In many places, such as across Europe, North America, and parts of Asia, we are observing an increase in influenza-like illnesses and acute respiratory infections compared to baseline levels. This rise in cases is in line with seasonal expectations, but it is still a reminder of the ongoing impact of respiratory illnesses during winter. Seasonal influenza activity, for instance, has been elevated in many countries across the Northern Hemisphere, with healthcare systems carefully monitoring trends and preparing for any significant increases in cases.
One area of particular interest recently is China, where there has been a noticeable rise in cases of hMPV, along with other respiratory pathogens like seasonal influenza and RSV, particularly in the northern provinces. While these increases are consistent with the seasonal patterns we see every winter, there have been reports suggesting that hospitals in certain areas might be facing challenges. However, Chinese health authorities have stated that the situation is under control, with no reports of overwhelming the healthcare system or any emergency declarations being triggered. The World Health Organization, WHO, has been closely monitoring the situation in China, as well as in other countries across the globe, through collaborative surveillance systems. Based on the available data, there is currently no indication of unusual outbreak patterns or cause for alarm. Influenza remains the most commonly detected pathogen in China, but the increases in cases are generally within the expected range for this time of year.
It's important to note that while many of these infections, including those caused by hMPV, are mild and typically result in upper respiratory symptoms like a common cold, some individuals, especially young children, the elderly, and those with underlying health conditions, may develop more severe illnesses like pneumonia or bronchitis and may require hospitalization. That is why continued surveillance and preparedness are so important. The WHO, in cooperation with national health authorities, continues to monitor respiratory illnesses at global, regional, and country levels, keeping an eye on trends and responding as necessary. This collaboration helps ensure that health systems remain vigilant and responsive to emerging trends, providing timely updates to the public and healthcare professionals alike.
For now, the rise in respiratory infections is expected, and health authorities are prepared to manage the situation. It's a reminder for all of us to continue practicing good hygiene, stay informed, and take preventive measures, such as getting the flu vaccine, to protect ourselves and others during this winter season.
Do like, share, and subscribe.
Thanks for watching.